Hello my friend, today's topic is all the main problems with erections and what you need to do about them. Why is it important to watch this video until the end? Because today you'll finally understand what your problems are connected to, where they come from, and at least you'll know how to solve them. Because if you don't know the real cause, you can waste a lot of time, a lot of money, nerves, and let the main problem get worse, and then it will be even more expensive to fix. And more difficult, and possibly there will be consequences that you'll have to live with for the rest of your life. Most erection problems actually occur. Many people think probably at 60 or 70 years old that mostly patients come to me and to urologists at 80 years old. No, unfortunately most patients don't make it to us. Do you know why? Because most of the patients are young guys. These are the ones who have recently started their sexual life, or those who are just planning to start and they feel anxious. This is especially true for those whose sexual debut, so to speak, has been delayed. It's planned to happen at 20, but actually happens at 22 or 23. They worry a lot, especially now that so much pornography is available. They observe and envision an ideal scenario where erections occur instantly and everything seems perfect. Merely viewing a nude woman is expected to be highly arousing. The first few attempts often don't work out as planned. And the first unsuccessful sexual experience creates a kind of bad programming, a lack of self-confidence. This is called the failure expectation syndrome. And it becomes harder and harder for a person to have sex if this problem hasn't gone away. He starts Googling, he starts asking his friends, asking how things are for them, reading what people write. And he types in his symptoms and gets results about vascular problems, hormonal problems, problems with the innervation of the penis. He finds signs of his disease everywhere. Today I'll explain how to identify your cause. First, you need to understand that if masturbation happens with a normal erection, if you used to have normal sex before, for example, and suddenly, specifically with this partner, specifically right now something didn't work out for you, then most likely it just happened that way. You got nervous, your stress hormone prolactin increased, for example, and it didn't work out for you. As Tony Stark said, sometimes not everyone can do it. Sometimes this happens to men, especially at the beginning of their sex life.
This happens to men not often, maybe once out of 5 times.
There are different psychological types. Some people are ready to have sex at the first meeting. Some are ready to leave the club with someone they just met. But there are people who are just physiologically different. They can't have sex with just anyone they meet. They need to get to know each other. They need to learn about each other. They definitely need feelings. You must understand that this isn't an illness, but a feature of your psychological type and psyche. You can't simply have sex with someone like an animal. It's not a sickness, but your characteristic. All people are different. That's the first thing you need to know. Second, you need to understand that there are several main causes of problems with erection. The first is a problem with the artery or vein. The second is problems with the nerves. By nerves, I mean innervation. The third is problems with the psyche, with the mind, meaning psycho-emotional disorders. And the last point is hormones. Do you know what the important thing is? It doesn't matter if it's nerves, blood vessels, hormones, or the mind. It always gets involved. And the longer you go on, the longer this curve of unsuccessful sex life lasts, the more the problem gets rooted in your mind, the more it eats away at you. And sometimes, even when we've already solved the main problem, the one that's left in your mind still lingers for a very, very long time. And even when there's no longer a physiological problem, it still doesn't let you have normal sex. It's not about the couple in the kitchen, it's about the couple in your head. That's exactly why it's important to identify the problem right away and not look for something that isn't there. And let's break it down point by point. Let's start probably with the blood vessels, if we're talking about arteries, because the penis is supplied with blood by arteries. In general, why does an erection even happen? The inflow of blood increases and the outflow decreases. For example, if the inflow is insufficient, this is called vasculogenic erectile dysfunction. Vascal means vessel, so it means the blood supply is insufficient. That can happen. Yes, it can happen. And this can happen at 25, at 30, or at 60 years old. But arterial problems don't appear with the snap of a finger or in just one day. If suddenly, even if you are diagnosed with this by ultrasound, you had a good erection, and suddenly it started to disappear. They wrote that there are likely no problems with the artery despite what they said. The main cause of arterial insufficiency is diabetes. These are diabetic problems because the blood vessels start to suffer, they begin to narrow. This usually happens gradually. progressing slowly year by year, starting at around 45 to 60 years old. This is the main characteristic of all angiopathies. There are injuries to the penis, and sometimes fistulas form between the artery and the vein, and the blood doesn't go into the penis, but, for example, is immediately discharged into the vein. This happens most often. If this is congenital, then you will have problems with erections from birth. It's crucial not to mix up potency and erection. Potency is the desire or wanting to, while erection is the physical ability or being able to. Let's move on to arteries. So gradually, slowly, everyone understood. Veins as well, they also don't appear suddenly. If there's a problem with the valve mechanism, meaning there's blood leakage from the penis, the inflow is good, the arteries are supplying blood well to the penis, but the veins can't handle it. You've seen varicose veins on legs, now imagine the same kind of varicose veins somewhere deep inside the penis and the blood just drains away. In such cases, a series of tests are done. This is where a Doppler ultrasound of the penile vessels is performed and we can see if there's a pathological leakage. At the same time, we check the condition of the arteries, and there actually are some. This type of test is called cavernosography. We inject contrast into the penis and observe how it drains during an erection. There is one particular feature when there are problems with the venous valve system. It's easier for you to have sex or masturbate while lying down, and it's harder for you to do it while standing up. Choose a position that provides a stable erection, as some positions may not be as effective for maintaining it. This can happen with psychogenic causes, and it can also happen with hormonal ones. According to physics, maintaining an erection is more difficult in this position compared to lying down. Well, it's just the laws of physics, because liquid tends to flow downwards, so there's no need to get hung up on it. Every word I say about recording, spotting symptoms, or identifying veins and arteries should not be taken as definitive, as that's not how it works. The real problems are with the blood vessels. They're really bad. Why? Because it would seem, yes, there's a bad vein, just tie it off and everything will be fine. But unfortunately, just like with varicose veins, when we tie off the main vein, the blood starts to flow through other branches, which are also basically diseased. The effect of surgery diminishes over time, making all these operations temporary. It's the same with arterial insufficiency. There are surgeries called penile arterialization when an artery is transplanted into the penis, but these are also temporary solutions. Yes, the third issue is hormones. We recently made an episode about this, where you can learn about the signs. If you experience erectile dysfunction symptoms, it's important to have your hormone levels checked regardless of the specific type. Because if you have a problem with your veins, sometimes people come and say, I have a problem with my erection. If your potency is fine but your erection isn't, that's okay. But if you also lack desire, definitely get your hormones checked. But I actually recommend everyone with erection problems to definitely check their hormones, even if you don't have any signs of testosterone deficiency. Sometimes there aren't any, make sure to check. Sometimes doctors hastily prescribe hormones, attributing everything to hormonal imbalances. What cause and effect relationship is truly at play in such cases? Hormones were prescribed and he starts feeling better. Libido and potency improve. If you're prescribed a large amount of testosterone naturally, you'll probably feel better, especially if you're given high doses of testosterone, and in your mind a cause and effect relationship is formed. They injected a large dose of testosterone, almost like a full course, and I felt better. The problem must be with the hormones. That's not always the case. Sometimes psychological problems go away because of this, and sometimes the component of arterial insufficiency or venous insufficiency is simply compensated for. It's the same thing as when many urologists, andrologists, and endocrinologists say that the patient doesn't have depression. I put him on testosterone and everything went away. So, since it went away, it means that's not the issue. No, maybe the issue is depression. But testosterone also affects a man's mental and psychological state. And sometimes we treat one thing through overcompensation, meaning we give more testosterone than necessary and naturally things get better. For such patients, if the cause is not eliminated, then unfortunately, even while taking testosterone medications, the problem eventually reappears. But then, when it reappears again, if it's missed arteries, veins, or some other psychological component, then it happens even while on their own testosterone. He's on testosterone replacement therapy, making it nearly impossible for him to have sex without proper indications, even with medications like Viagra, Cialis, Levitra, and others. Hormones are one of the main causes of erectile dysfunction. And don't think that just because you're not 50 or you're only 30 or even just 20, that this won't affect you. Certainly, each age has its unique risks. But as practice shows now, even among young patients, the average age of my patients who come to me for consultations is about 30 years old. That's why I decided to create a special project called Checkup. You'll hear about it soon, and you'll be able to easily and simply check your entire basic endocrine system at home and get the results explained. A specialist who will tell you which direction you should go and where you might have problems. You might need more tests or research, or they may say you're healthy and can continue with your life. I will definitely share all the news about checkups, questionnaires, and useful information about hormones. You can find all of this on my Telegram channel. The link is below the video. Check it out, subscribe, and I'll be happy to help. To you, as they say nowadays, every self-respecting man should have Cialis or Viagra in his pocket. In reality, that's nonsense. Nonsense. Because 85 to 90% of the prescriptions for this drug and its analogs are for medications that help you achieve and maintain an erection. Unfortunately, these are the cases where it isn't needed, the cases where something was missed, something wasn't treated. If the endocrine background is poor, it's simpler for doctors to prescribe medication or dismiss the issue as psychological without properly interpreting tests and identifying the root cause. You blame the person for their problem. If there's a problem that can be solved by correcting, let's say, the hormonal background, then why take these medications? Thus, having a healthy endocrine system is crucial. It's extremely important to know everything about yourself, to know what your testosterone level is today and what it will be tomorrow. I often mention testosterone automatically, although for many patients the issue isn't really about testosterone. For instance, your estradiol levels might be too low or high, or your prolactin may be elevated. Sometimes a growth appears in the pituitary gland that might not even be visible on a magnetic resonance imaging yet, but it releases the hormone prolactin into your blood, and that suppresses your response. And your libido, by the way, too. A simple example, during orgasm, your prolactin level spikes. Tell me, do you really want to have sex at that moment? After the patient has ejaculated? Well, after you've ejaculated, probably not. So part of what you feel is actually related to the increase in prolactin levels. And that's also why a breastfeeding woman doesn't really want to have sex. That's why it's extremely important not to just take pills. By the way, I really wanted to talk about something. There's a lot of advertising on the internet, and I sometimes prescribe it myself. There's this paste. I won't mention the name, but everyone who's tried it knows. And this paste is for erections. There are a lot of similar supplements, similar additives on the market that supposedly miraculously boost your potency. But at the same time, they cause all the same side effects: nasal congestion, redness, facial swelling, coughing, and sometimes increased heart rate. Just like all the analogs. Why? Because most often, all manufacturers simply use a very cheap, low-quality product, generics of all these drugs, mixing them with some herbs. And they say that people are more willing to take dietary supplements, more willing to use some biological additives if they help them. But this is extremely dangerous because these drugs have a huge number of side effects. Therefore, dear friends, if you plan to use such drugs even as dietary supplements, be sure to consult a specialist. So the same goes for high prolactin. You can take Viagra, or you can cure yourself of a prolactinoma, that is a pituitary tumor that poisons your body with high levels of prolactin. I'm saying words that might be unclear to some people because maybe a 15-year-old boy is watching us. For him, all of this is new. I'm not an athlete already familiar with these hormones. I'll make a video about this soon. In one of the upcoming episodes, we'll talk about which hormones you should get tested. What list of basic checkups does a man need to get to check himself? Naturally, the checkup is different. For erectile dysfunction, it's one set. For suspected hormonal deficiency, it's another. An older man needs completely different tests, including tumor markers. That's why we'll definitely make an episode about this. Subscribe to the channel, hit the bell, and you'll be the first to know about it. The last, but sometimes the most important component is psychogenic erectile dysfunction. It can be isolated. That is, the main reason is that the person feels insecure, awkward. This often happens, in fact, in Caucasian families when a person does not have the opportunity to have sex due to religious beliefs. And with the first, there are a lot of problems with the first partner. It's especially nerve-wracking because for her, basically, it's also the first time. It's important to understand a simple thing here. This is not a disease, it's a state of mind. Dude, the most crucial aspect is that they must also be examined. They need to have their hormones checked. Sometimes they might even need an ultrasound to convince them that there's no problem there and that the only thing holding them back is their mind. In such cases, the best option is all the medications we discussed. A positive sexual experience is the best remedy for treating psychogenic and erectile dysfunction, because it joins in, as I said, whether you have a problem with your blood vessels or with your nerves, if there was some kind of injury or an aneurysm appeared. That is, any problems always get worse if they last a long time in your mind. And the best medicine, even after you fixed it, is still to give the person supportive stimulation for several months, sometimes even up to half a year for some people, so that he forgets about it, so that he gains confidence in himself, and then gradually taper him off the medication, then everything will be fine. Even with suspected psychogenic erectile dysfunction, always have a comprehensive examination. Today, a comprehensive examination of a patient with erectile dysfunction includes a hormonal profile and filling out questionnaires. By the way, they are on my Telegram channel. I've posted them there and may repost, so feel free to check it out and subscribe. The third is sometimes a Doppler ultrasound of the penile vessels, which is an ultrasound to check the blood flow. Specialized devices can be attached to the penis to determine nocturnal erections when patients report no daytime erections and no other methods help. But at the same time, his penis is erect at night. Yes, your penis also gets erect at night. That's normal human physiology. At night, we have many and fairly long-lasting erections. If they occur at night, it's a clear sign of erectile dysfunction of psychogenic origin. And even when a person understands this, when we show him the charts, here's the frequency, here's the duration, it reassures him. Recently, I had a patient who said he was having serious problems with erections, but we were actually treating something else. He said there was no erection, it wouldn't stay up, it was unstable, and it would go down right away. He was under anesthesia, and his head turned slightly to the side. He's lying in the hospital room after the surgery, and his penis is rock hard, almost like it's steaming. He himself admits that the current situation hasn't occurred in a long time. And at that moment, he realized that the psychological component is actually very significant. This helped him look at the problem differently, to actually start working on it, to accept it, and not to look for some other issues. A quick overview, we've covered the main reasons. Of course, it would be right to make a detailed video about each one separately, and we will definitely do that. Thanks for watching, subscribe and stay tuned. I'll make a video on each issue. And what exactly should be done in terms of diagnosis and treatment, what to expect, what not to expect, and what does modern medicine say about this today. Goodbye, everyone.